serious eye disease affecting an estimated 3 million Americans. We're talking about glaucoma, but the problem is only half of those 3 million affected actually know that they have it. Joining us this morning, an expert in the treatment of glaucoma, Dr. Ronald Barkey with the Whitman Eye Center. Dr. Barkey, good to see you again.
Thank you for having me.
As we mentioned, this is a serious eye disease, and I imagine if a lot of people don't even know they might have it, they probably don't even know what it is. So what exactly is glaucoma?
Okay, so glaucoma is a disease of the optic nerve. It involves the intraocular pressure in your eyes, or poor circulation, or mechanical obstruction. But importantly, if it's not treated, it can lead to permanent visual loss.
Scary. So how common is it, and who's more likely to maybe have it?
Okay, so the risk of glaucoma increases with increasing age. If you have a family history of glaucoma, that increases the risk. Certain medications and certain medical conditions cause glaucoma. And as you said, there's over 3 million people in the United States that have glaucoma, and half of them don't know they have it.
So scary.
There's over 120,000 Americans who are blind from glaucoma.
Okay, well, there are some treatments, though, available. We're going to start with the first one, and that's an annual eye exam.
Well, the trick is to first diagnose it.
Yes.
So since it's mostly asymptomatic, it's important to have an annual eye exam to make the diagnosis. We look at your intraocular pressure, we look at your visual field, we look at the appearance of your optic nerves. And so that's why it's important to come in and let us have a look at you. But importantly, it's like any chronic medical condition, diabetes, high blood pressure, it's important to have routine follow-up.
Okay. You say eye drops is another option.
Right, right. We treat glaucoma with eye drops. Sometimes we treat glaucoma with lasers. Sometimes it requires major surgery to treat it.
Okay, let's talk about the laser treatment specifically. What's it called and how does it work?
Okay, the SLT is a laser that opens up the drainage channels in the eye.
Okay.
So you open up the drainage channels, that lowers the intraocular pressure, and if you lower the intraocular pressure, that decreases the risk of damage to your optic nerves.
Okay, a lot of people have this, as we mentioned, 3 million Americans. A lot don't even know they have it. So what advice would you give to people out there who may be thinking, gosh, the things you're saying sounds familiar. What if I might have it? What do they need to do?
Schedule a comprehensive eye exam. You need to have your eyes checked once a year to look for glaucoma, for cataracts, for other eye diseases.
Okay.
We have 6 Metroplex locations now.
All over the place.
You can come see me at one of our 2 Arlington locations, but we also have offices in Plano, in Dallas, in North Dallas, and we have a glaucoma specialist seeing patients in our new office in Mesquite. The important thing is that glaucoma is a medical condition,
yes.
So your medical insurance should cover your eye exam.
You say the eye exam once a year. I'm curious, is that no matter what the age? Because sometimes you hear, as we do get older,
right,
sometimes you need to see your specialist a little bit more often. Is that the case with glaucoma?
Well, just like with a lot of medical conditions, the prevalence of these things increase the older you get. So pretty much after the age of 40, you ought to have a yearly eye checkup.
Okay, and that's the most important thing, because if you don't know you have it, you're not going to know you have it until you see a specialist.
That's right, and it's asymptomatic, so there's an awful lot of people that have glaucoma and don't realize they have it.
So scary. All right,
yeah.
Got to go get those eyes checked. Thanks so much, and it's good to see you again.
You're welcome.
All right, here's the information. You can call Whitman Eye Center. The number's on your screen now, 214-220-EYES. For more information or to schedule an appointment, that's 214-220-3937, or you can always log on to keywhitman.com.